Hello, my name is Anne-Marie Whitney, and I'm a CRNA or a nurse anesthetist. I provide labor anesthesia at my hospital along with anesthesiologists in my department. The purpose of this video is to provide women with informed choices for pain relief during labor and delivery. Our goal as nurses and specialists is for all patients to have a safe and satisfactory labor experience with reasonable expectations and relief from anxiety. Labor is a unique experience. The best patient care will require coordinating with nurses, obstetricians, midwives, and anesthesia providers. There are many choices for pain relief that exist to make the labor process easier for the patient. Such examples include intravenous medications such as Nubain, inhalation anesthesia with nitrous oxide, which is used worldwide, and an epidural or a spinal anesthetic, which has been used successfully for decades. While anesthesia for labor is elective and an individual choice, nurses also have expertise in non-invasive techniques to help patients with pain relief. These include hot and cold therapy, relaxation and breathing techniques, and special positioning techniques. As your labor progresses, your obstetrician and labor nurse may suggest medication intravenously or by inhalation. Some patients find these choices to be enough through labor to delivery. However, many prefer to have more complete pain relief or analgesia in the form of an epidural. Epidural is considered the most effective form of intrapartum analgesia currently available, and 60 to 70% of women worldwide choose epidural analgesia for labor. An epidural is a procedure that involves injecting a medication in the space around a patient's spinal nerves, known as the epidural space. Epidurals take away the pain of contractions and, as a result, sometimes prolong a labor. Prior to this procedure, an anesthesia evaluation will be performed, and the patient's history, vital signs, lab work, and pregnancy course will be discussed. Written consent for the procedure will also be obtained. To begin the procedure, an epidural catheter or small tube is placed via a needle into the lumbar section of the spine, located in the lower back. The purpose of this is to continuously give the patient local anesthesia or numbing medicine for the duration of the labor until delivery. A support person may be present for the patient during this time, and an explanation of the procedure will follow as the catheter is placed. It is necessary for a patient to stay in bed while the epidural is working, as this procedure causes the legs to become tingly and the patient will not be able to stand or walk very well. Feeling pressure from the epidural is completely normal. Once discontinued, it may take an hour or so before a patient feels normal again. Additionally, a patient may feel soreness where the epidural catheter was placed once it is removed. Almost everyone can have an epidural for labor and delivery, and it is unusual for a patient to experience long-term effects from this procedure. Things that may prevent an epidural from being used include infection, use of blood thinners during pregnancy, a brain lesion, or a patient's inability to remain cooperative during the procedure. Data suggests that intravenous, inhalation, and epidural anesthesia have minimal effect on the fetus. However, side effects can occur with labor analgesia. For instance, patients may experience nausea and vomiting if they elect to use intravenous or inhalational anesthesia. Side effects from epidurals can happen as well. The most common are lowering of the blood pressure, itching, and nausea and vomiting, all of which are usually temporary. Additional side effects that may result from an epidural include shivering, an increase in temperature over time, and delayed gastric emptying. Patients may also have difficulty urinating during an epidural, and it is not uncommon for a catheter to be needed to void during the labor process. Finally, Inadequate pain relief from an epidural may require additional medication to enhance relief. There is a 1.5% chance of a spinal headache resulting from the procedure. Furthermore, replacement of the epidural catheter to obtain pain relief may be necessary. The risk of nerve injury or infection are very rare. In conclusion, the pain relief methods of intravenous, inhalation, epidural, and spinal anesthesia are typically available to laboring women at the hospital. Additionally, labor nurses are trained to provide patients with non-invasive pain relief techniques. All of these options are time-tested and have proven over many years to help during the labor process. It is my hope that this discussion will aid patients in deciding what pain relief method is best for them before the onset of labor. This information is meant to decrease anxiety and increase patient satisfaction. Thank you.